Dobre Utra. First, I would like to say that it's an honor to be presenting here today. A big thank you to the Naked Heart Foundation for inviting me. I've had such a good experience so far, gotten to meet people and discuss this very important topic with experts from around the world, which has been really wonderful. I was asked to present today about the parenting stress that's associated with having a child with autism and what we can do to better support and help these parents. So I want to begin this talk by focusing on something that we all have in common with each other. So everyone in this room cares about children. We all want to help children in some way. Many of us are parents, and we're busy caring for our own children. These are mine here. They keep me very busy. As you know, when we work with children, well, in addition to being parents, many of us are also professionals who have dedicated our careers to working with children and helping children. And when you're working with kids, you never work with them in isolation. So kids have families, kids have parents. Parents are really our partners when we are trying to help kids. They're partners who are doing just as much work as we are, often much more work than we're doing as professionals. They're just not getting paid for the work that they're doing. But they're doing amazing work with their kids day in and day out. And if we want to help kids, we really need to work to support the parents. Next slide. So I want to tell you a little bit about where I'm coming from. I work at the Marcus Autism Center, which is in Atlanta. It is one of the largest and most comprehensive centers for clinical care in the United States. We see over 5,000 patients per year. We have several different programs at our center. We have programs that target severe behavioral problems. We have programs that help children learn and acquire language skills. We have programs that target feeding and sleep problems. We have my clinic at the center, which is really focused on diagnostics, doing assessments and figuring out which children have autism and then making a treatment plan for them. So our center is in the midst of a big transformation. We're going from being a center that really focuses on clinical care to really integrating research into all aspects of our work. Our goal is to be a hub of clinical science. We've got good research that's informing our clinical practice, and our clinical practice also informs our research. Currently, we have studies that look at genes, neurobiology, brain and behavior. We have animal models of autism that we're working on. We're looking at different behavioral treatments, medical treatments. We really focus on early diagnosis. And then we have a new initiative that's really focused on empowerment of families and empowering the community to help these kids. Next slide. So just to take a step back, autism is a neurodevelopmental disorder that is characterized by impairments in social communication, reciprocal back and forth social interaction, as well as the presence of these restricted and repetitive behaviors. Next slide. Current estimates from the Center for Disease Control, which is right down the street from me, says that about 1 in 88 children has been identified with autism spectrum disorders. Other studies in Asia, Europe, and North America have identified individuals with autism with an average prevalence of about 1%, though a recent study in South Korea reported a prevalence of about 2.6%. So this problem is very prevalent around the world. Next slide. So research has shown that a diagnosis of autism at age 2 can be reliable, valid, and stable. But still, most kids in the US are not diagnosed until after they reach age 4. Interestingly, studies have shown that parents of children with autism usually have noticed some sort of developmental problem before their child's first birthday. Next slide. So, in my role at our center, I do a lot of diagnostic evaluations. So I'm often present when the parents are first told their child has autism. In fact, I'm usually the person who's giving them this really tough news. And just like we heard from our last speaker, it's hard news for these parents, and there's often a very big emotional reaction. With the diagnosis of an autistic child, parents have been reported to experience complex feelings that include the feeling of losing a loved one. The reaction to a loss has patterns of shock, denial, depression, and acceptance, as well as guilty feelings, depression, and anxiety. Next slide. So current theories of grief suggest that parents of children with developmental disabilities experience episodes of grief throughout their child's life cycle as different events unfold. So that grief reaction isn't just happening when they first hear the diagnosis, but any new event or new milestones, such as birthdays or holidays, can trigger this grief reaction again. Experiencing this chronic sorrow is a psychological stressor that can be frustrating, confusing, and depressing for parents. Next slide. So I want to spend some time talking about the different events that might occur in a family over time and how these might be experienced, each one as a new loss by the parents. So sometimes the first event is that the child is identified as being at risk, and parents experience a loss of the natural optimism they had for their child. Often, parents begin to recognize that their child is slow in development, but other people are reassuring them that everything is okay. And then they have a loss of confidence and a sense that they're not being heard by those people in their support group, their support network. When the child is diagnosed with a disability, there is a loss of optimism that their child's childhood is going to be uneventful. Next slide. Often these children get involved in several different medical and rehabilitative services, and parents experience a loss of privacy associated with that. Being informed that the disability may have lifelong implications, the parents experience a loss of plans for the future and plans for what they hoped would be textbook child rearing. As the child's progress and future reports continue to confirm the diagnosis, parents may experience a loss of hope that maybe the diagnosis was a mistake. Next slide, please. Often people in the community continue, like family and friends, will continue to reassure the parents that they think everything is fine, that there's not really anything wrong with the child. Or at other times, they might start to avoid the family because they don't know what to say. And so then the family is losing their pre-diagnosis support system. There's often a breakdown in the couple's communication. And so then there's a loss of the sense that the mom and dad were a team and they were together in this and they were supporting each other. Something that's been touched on here and I think is really confusing for parents is when they get contradictory news regarding their child's diagnosis. Sometimes the professionals disagree about what the diagnosis is, or the professionals disagree about what kind of treatment the child should be in, and this is really hard on families. They experience a loss of confidence and trust in the professionals that are working with their child. Next slide, please. Another thing that's hard for families is, especially in these early years and the toddler years and preschool years, there's often no clear answer from the professionals of what to expect. And so then parents aren't able to anticipate a particular course of events. They don't know exactly what to expect, and that can be very difficult. And parents can't help but compare their child to other kids of the same age. And then there's a loss of that anticipation that their child would be like other children in all things. Next slide, please. As the child goes into primary school or elementary school, the child often becomes involved in special education programs or special school. So then the parents experience a loss of hope that the child could be in a normal school setting. When school personnel reconfirm that diagnosis, there's an additional loss of that hope or the fantasy that maybe the child's disability would improve by school age. Another thing that happens as children get older, their disability is often more easily noticed by the untrained eye. So people who aren't professionals are noticing that maybe something is wrong. And so parents experience this loss of the hope that maybe the disability would be unnoticeable. Next slide, please. As the child gets taller and heavier with increased strength. There's a loss of the hope that lifelong care of the child would not be a great burden. Also, some parents describe that teachers seem to react more coldly to their emotional concerns as the child gets older. And so then the parents are experiencing a loss of the emotionally supportive environment that they experienced when the child was younger. As the child grows into a teenager and gets into secondary education, often the school places the child in a transitional program or vocational programming, and then parents experience the loss of the hope that that child would go to college. Lots of times these kids are still struggling to learn their basic academics at this age, and there's a loss of the hope that they would outgrow the disability at some point. Next slide, please. In the secondary school years, several day-to-day tasks might continue to be difficult for these children. So performing chores around the house, being able to handle small purchases or money on their own, being able to take care of their own transportation needs, being able to tell time. So with each of these difficulties, the parents experience a loss of that hope that the child could live independently and take care of these kinds of needs on their own. Next slide, please. Often teenagers begin to express some personal emotional response to his or her own disability. And so then parents experience a loss of the desire to have the child accept their problems without having grief of their own. And teenagers may choose to terminate therapy or terminate their school. And so there's a loss of the anticipation that the child would want to be as normal as possible, as the parents had hoped. Next slide, please. Does this say adulthood at the top? No. Does that one say adulthood? Okay, now we're on the right side. Thank you. I think I forgot to say next slide, sorry. So transition into adulthood brings with it a new set of challenges. The adult child may remain at home with the parents, and this could be experienced by the parents as a loss of the hope that others would be able to take care of the lifelong needs of their child. Also, the child might be placed in, as an adult, might be placed in group home or supervised living. And then there's a loss of the belief that the parents would be able to physically and emotionally care for the adult in their own home. Next slide. Another issue in adolescence and adulthood is emerging sexuality. So the adult child may announce plans to enter into a romantic relationship or to marry, and parents would experience the loss of the anticipation of their child having a normal marriage. The married adult child may announce intentions of having children. Parents may experience a loss of the anticipation that parents would no longer have to worry about their child once he became an adult, or loss of anticipation about being normal grandparents. Next slide, please. So the traditional stages of grief and mourning, there are 5 stages. The first is impact. This is associated with shock, anxiety, and disorganization, and it's generally pretty short-lived. Denial comes next. This is protest. It's a defense mechanism. Grief comes next, and it has anger, guilt, despair, sadness, and blame. Reorganization is the next stage. At this point, parents are better able to focus their attention outward. And then the last stage is closure, and with that comes acceptance. Next slide. So associated with the traditional grief model is the concept of chronic sorrow. We have just reviewed the losses that are experienced over the lifetime associated with the child who has a disability versus a typically developing child. Parents are sometimes told that they are stuck in denial, that they haven't moved on to acceptance. But there's anticipation in the model that grief work will be completed. And often this is the expectation of the professionals who are involved in the child's life. Next slide, please. The chronic sorrow model views the work of grief as being finite. This model contrasts with viewing the process as one of lifelong awareness. Not accepting the dire predictions at every point along the way and not projecting too far into the future may not be pathological denial, but instead may be more adaptive and what one author has called positive illusions. These positive illusions allow parents to maintain an optimism and a sense of expectation and hope for their child. Next slide, please. So in addition to this ongoing grief that parents are dealing with, parents of autistic children also experience high levels of stress related to their child's symptoms. Next slide, please. So a large body of research has investigated the stress associated with having a child with autism. Some commonly used measures of parent stress include the following. One measure that's commonly used is the Parenting Stress Index. This is a questionnaire that parents fill out that has about 100 questions that asks about several different stressful events related to the caregiving they do for their child. Studies have also looked at rates of anxiety and depression in these parents, reports of marital satisfaction, divorce rates, and the financial hardship associated with caring for a child with autism. Next slide, please. So a quick summary of some of these research findings. Several different studies have shown that parents of children with autism experience significant stress when compared to the parents of typically developing children. And also they seem to experience more stress than parents who have children with other kinds of disabilities, such as intellectual disability and Down syndrome. One study found that mothers of children with autism exhibit increased symptoms of depression. And there are findings that fathers of children with autism were more likely to cope by distancing themselves from their family. Also, there are several studies showing parents of children with autism report lower marital satisfaction when compared to parents of typically developing children. Next slide, please. So how do the symptoms of autism impact the family in such significant ways? Next slide, please. So I'm going to go through some of the symptoms of autism and how these symptoms in and of themselves can be stressful. Clearly, lack of language is very stressful for everybody involved with the child. When a child cannot express his wants or needs, this leads to problems with frustration, both for the child and for the child's parents. These frustrations can lead to tantrums and aggressive behavior towards self and towards others. Next slide, please. Children with autism can become very distressed by small changes in their routine or their environment, as you know. Certain noises or textures may be very distressing. Often the thing that's upsetting them is something that might not be clear to the adult who's with them. And so it seems like they're having a tantrum that just comes out of the blue, which can be hard to manage if you don't know what's leading to that distress. Next slide, please. So parents of children with autism report feeling embarrassed, scrutinized, and frequently criticized by other people, often criticized by strangers who they don't even know. Simple activities such as going to the market can seem like an ordeal. Another big problem for lots of parents is some kids with autism will run away from them when they're in a public place or in a parking lot. And so parents have a lot of fear about being in public with them, that they're not going to be able to keep them safe. Next slide, please. Because of the lack of social interest and appropriate play skills, these children often require constant structuring of their time. So they might not be able to independently sort of organize themselves to play a game, but need all of this help and support from their caregivers. This can be a difficult task for parents in many different settings, and parents end up with very little time to maintain their own activities or their own friendships. Next slide, please. Sleep disturbance. So this is something that comes up a lot when I'm talking to parents. They often struggle to get their child to sleep through the night. This can be physically exhausting for families and very emotionally draining. Just a few weeks ago, I was speaking with a mother of a 3-year-old, and this is what she described. I have to rock Jane for 2 hours every night to get her to sleep. She will sleep from 10 o'clock p.m. until 1 o'clock a.m., but then wakes up every few hours and is up for the day at 5 o'clock a.m. So you can imagine that after years of only getting this amount of sleep, everyone in this family was completely exhausted. And the mother described to me that she had a list of things that she wanted to accomplish and things she wanted to do for her child, but she was so exhausted and so tired, it was hard to get herself organized to accomplish any of the things on her list. Next slide, please. So this lack of sleep affects the parents, but it also affects the child. If you're chronically tired, it can lead to more behavioral difficulties for the child and affect their ability to learn and to benefit from the therapies that they're involved with. When parents are chronically tired, this also affects the parent's own ability to cope with the situation and to deal with their child's symptoms and very high level of needs. Next slide, please. Does this say feeding difficulties at the top? Yes, okay. So research suggests that 95% of children with autism spectrum disorders have some kind of feeding difficulty. This is very prevalent among these kids. Some of these kids have pure, true feeding disorders, like failure to thrive, because they're not eating enough food to get adequate nutrition. For a lot of these kids, it's just that they are very picky eaters. They might have only a few foods that they're willing to eat. There can also be rigid routines at meal times, and a lot of sensory sensitivities or interests might get in the way at meal times. So they might want to avoid certain textures, certain smells, or maybe their food has to look a very particular way. Next slide, please. So because of these problem behaviors related to eating, many families are not able to eat together at meal times. So this is a significant source of stress for families, and it happens at least 3 times a day. Also, as a result of this, children with autism often end up eating alone rather than eating with their family, or rather than eating with their peers at school. And so this is compounding their social isolation. Next slide, please. The other problem we see with feeding is often these children will only eat proteins and starches and refuse fruits and vegetables. So this poor nutrition can contribute to problems with their emotional and behavioral regulation. And this type of diet can also contribute to problems with obesity and other problems later on in life. Next slide, please. Adaptive skills are something that we talk about a lot at our center. These are day-to-day skills that are necessary to take care of yourself and to get along with others. And children with autism often have many different adaptive delays. Things like feeding oneself, getting oneself dressed, toileting issues, or helping with household chores. Next slide, please. So with the arrival of a child with disabilities into the family, there's a shift in the roles of all of the family members. This shift in the traditional or expected roles affects not only the current members of the family, but any future family members as well. Next slide, please. The child's maladaptive behaviors may prevent families from attending events together or spending time together as a family. And this has an impact on the marital relationship. Spouses often can't spend time alone due to their extreme parenting demands, and their concerns that there isn't anyone else who's qualified enough to watch their child for them. Next slide, please. Parents of children on the autism spectrum may experience a sense of isolation from their friends, their relatives, and their communities, for all of the reasons that we've just talked about. Next slide, please. Another big problem for these families are financial stressors. Having a child on the autism spectrum can drain a family's resources due to the expenses, such as the evaluations, home programs, or various therapies. Also, the caregiving demands of raising a child with autism may lead one parent to give up his or her job. And this can exacerbate financial strains if it used to be a 2-income family and now it's down to a 1-income family. Next slide, please. So one of the most significant sources of stress for parents is the concern regarding future caregiving of their child. Parents worry a lot about who is going to take care of their child when they are gone one day in the future. Next slide, please. So we can't forget siblings. Siblings are an important part of the family, and having a sibling with autism can affect a child in many different ways. Some siblings report feeling embarrassed around their peers. There can be jealousy regarding the amount of time that their parent is spending with their brother or sister. Sometimes kids get really frustrated that they're trying to engage their sibling in play and their sibling's not responding to them, and they don't understand why. Sometimes siblings are the target of some of these aggressive behaviors. Next slide, please. Sometimes we see siblings trying to make up for the deficits of their brother or sister and having concern regarding their parents' stress and grief. So often these kids can take on kind of a caregiving role even though they're still just children themselves. And also siblings have a very reasonable concern about what their role is going to be in the future caregiving of their sibling with autism. Next slide, please. So how do we support families? What are some things we can do to help them as these roles are shifting? First, problems can be avoided by making roles clear within the family. So we encourage families to talk about what their new roles are and make clear sort of rules for the family, such as siblings are not caretakers. Parents should remember to maintain all of the other roles that they have in their life. So they are a parent to their child with autism, but they're also parents to other children, a spouse, a friend, a daughter, a neighbor. So loss of these roles and support can devastate the family cohesion and lead to disruption in support, and that can really threaten the family. It's also important for families to deal with any pre-existing problems that were in the family before this event happened. Next slide, please. So how do we help couples through this process? Couples have to communicate and make decisions on what will change and how it will change their relationship. There's no one right answer on what those roles should be and who should be doing which job. It's just very important for couples to communicate with each other about how they're going to handle these roles that they're in. A child with disabilities brings to the marriage a whole new set of responsibilities. And marriages can get into trouble when only one parent is willing to acknowledge these new roles and to make changes, or when parents are unwilling to share the responsibility and communicate about their needs. Next slide, please. So if resentments begin to fester, it's important to encourage couples to seek out couples counseling and to talk about these things and really work through them. And efforts should be made when working with families, not just to focus on the grief and all of these struggles, but to help them to look for the joy and the wonder of what occurs in your life when you care and love for someone who has a disability. One recent paper, which I think is really encouraging, is that the divorce rate among couples with an autistic child is actually no higher than it is in the general population. And this is a study that came out in 2011. So I think this finding suggests great resilience in these couples and families. They are really pulling together to help each other through something that's very difficult. Next slide, please. So the other way that we support families is by helping them to get intervention for their child. So we want to be trying to get children into intervention that targets, first of all, the core symptoms of autism. So we want intervention that aims to improve the child's communication, improve social interaction, reduce those problem behaviors, and then helping children to build imitative and spontaneous play skills. Next slide, please. But we don't want to forget these other things when we're doing our interventions either, because some of these issues can really change a family's quality of life if we can address these kinds of symptoms. So we want to help with the child's sleep. We want good sleep hygiene and adequate amount of sleep for the child and the family. We want to help the family work on these feeding issues. We want to work to broaden food choices and to reduce those problem behaviors around meal times. Sometimes parents tell us that that was one of the most meaningful interventions they participated in, was our feeding program. It can be really life-changing for some of these families to be able to sit down and have a meal with their child. Adaptive skills. We want to always remember that we want the child to be as functional as possible in the real world. So we don't want our interventions just to target behaviors that occur in the classroom or occur in the therapy setting. We want to support parents in teaching day-to-day skills, such as dressing and personal hygiene and toilet training. Toilet training is another life-changing experience. As a parent who finally has kids who are not in diapers anymore, it really changes your life when kids are able to be independent in these ways. Next slide, please. So Peter Doering has identified pivotal services for children with autism, and he identifies 4 services which he feels like are absolutely critical for children and their families. The first is autism identification and diagnosis. So screening and getting a diagnosis so that we know what we're dealing with can be essential to obtaining a variety of services for these kids. Another very important service is case management or case coordination. And this is something that we're actually really just getting started at my center. It's having a person to help bridge those gaps for parents, to help work across different agencies and different professionals, to help parents solve problems, and to try to pull all of the services together that the child may need. The third critical service is advocacy. So educating parents about autism and helping them to be advocates for their child. And the fourth is behavioral support. Children with autism and their parents often need support from many different professionals to address behavior and the related issues. Next slide, please. So current initiatives at our center, at Marcus Autism Center and at Emory University, is we're trying to build a case management team to provide some of these vital services to families. And some of the goals of our case management program seem fairly simple, but can be difficult to accomplish. First, we're trying to get shorter wait times for that initial diagnosis for families. A lot of families know that something's wrong, and they call centers and they seek out services and a diagnosis, but there's a huge delay between when they know something's wrong and when they're able to access services and help. We have a team of social work students and interns who are volunteering at our center to make phone calls, to call these parents. They call our parents who are waiting to be seen, and they call to follow up with parents after they've been given a diagnosis, to help answer questions, to help guide them to find the services they need, to help them process the diagnosis and to understand what it means. Also, we're working to provide continued support to families throughout the child's involvement in services, so that we have a case manager who is working with that family to help them identify financial support, to help find services, to help find the parents a support group, just being there for them, realizing that the parents might need support as they're trying to support their child. Next slide, please. So we hope to gather data to the extent, on the extent to which case management and coordination is going to help us to decrease the age of diagnosis. So we want to be seeing kids sooner. We wonder if supporting parents is going to help us increase access to services. We hope to decrease parent stress. And we also hope to improve the outcomes in children diagnosed with autism. Next slide, please. So talking to parents about autism. So it's very important how we talk to parents about this diagnosis. One of the main things that I say to parents, and I say it very clearly, is this is not your fault. Parents need to know that they are not to blame for their child's disorder. We know that the causes of autism are biological and genetic. As I talked about earlier, it is already quite devastating to be given the news that your child has autism. If parents mistakenly believe that they are to blame for their child's diagnosis, that can be quite paralyzing for them. It may lead to them being more hesitant to seek help for their child or for themselves. Also, because of the perceived stigma of having a child with a disability, many parents and professionals want to wait and see, rather than getting help for their child right away. I really encourage parents not to do this. I emphasize that early intervention can make a big difference, and I don't want to wait before I get intervention started. Next slide, please. And the reason we don't want to wait is that many of the associated disabilities of autism are not inevitable. So the behavioral problems, the lack of language, even intellectual disability, these things don't have to happen in many of these kids. So with early intervention, we truly believe we can change the course of this disorder for many people. And we know that the sooner we start, the better the result. Next slide, please. So we also want to talk to families about coping strategies. Research on parental coping tells us that for the most part, parents are quite resilient, and they are able to adapt to caring for a child diagnosed with autism. King, in his 2006 paper, underscores the importance of nurturing a sense of hope and seeing the possibilities ahead. Through realizing the possibility of a bright future, parents were able to gain a sense of control and empowerment. Next slide, please. So we also want to discuss other sorts of coping strategies with families, encouraging families to seek out individual, marital, or family counseling, encouraging them to join a support group. It can be really helpful for parents to meet other parents who are going through similar struggles and build a community around that. Other strategies such as keeping a schedule of things to accomplish, writing in a journal, exercise, yoga, deep breathing, prayer, all the kinds of things that we teach people as ways to be healthy and take care of ourselves can be helpful for these parents as well. Next slide, please. It's also really important to focus on the joys and the accomplishments of today. So it might be that you got your child to smile, maybe it's their interest and joy in a favorite toy, their contagious laughter, not always focusing too much on what tomorrow may bring. I think for anyone who works with children or who is a parent, it's very important to have a good sense of humor. Sometimes laughter is the best medicine, and we have to look for moments of joy and laugh with our kids. We encourage parents to research and ask questions and learn everything they can about their child's condition, the diagnosis, and any potential therapies. Next slide, please. Listen. So remember that parents are the experts on their own child. Others may be experts on autism, behavioral interventions, education, medication, or the like, but only parents are experts on their own child who has autism. We as professionals are going to make more progress with these kids if we really, really listen to their parents and value the knowledge and the experience that they have in being with their child. Next slide, please. I also always like to have resources available for families. So our lovely case manager who works with me was able to get some resources together that we give out to parents that we see in the US that are written in Russian. Some of these are from the Autism Speaks website. It includes an autism introduction video and an early childhood milestone map. And also there's a link to World Autism Awareness Day, which is really focused on advocacy. Next slide, please. Спасибо.
Спасибо за доклад. Я хотел бы узнать, занимается ли ваш центр работой с семьей как группой, как целым? Мой опыт показывает, что семьи, как правило, даже самый маленький ребенок, даже кошка может повлиять на аутичного ребенка. Вот меня интересует именно ваша работа с семьей как группой, как целое.
Okay, let me make sure I understand. Sometimes we have groups of several families working together, such as a support group. But we also have programs where we'll do therapy with the entire family together. Does that answer your question?
Да, именно в этом. Да. Я имею в виду те события, которые могут быть лечебными для ребенка, не на индивидуальном уровне, а на групповом.
I'm not sure I completely understand, but usually when we're working together with the family, it's on helping them to cope with some of these behaviors and potentially giving them specific strategies for how to handle some of the behavioral issues that I spoke about. So they feel like they're ready. They have a toolbox full of strategies that are going to work for some of these difficult situations they find themselves in.
Ну, хорошо, давайте, может быть, тогда слово «игра», может быть, поможет. Есть ли какие-то игры для всей семьи, которые помогают им адаптировать ребенка и лучше его понимать? Инклюзия, может быть, это слово поможет.
Yes, so it depends on the child's particular symptoms and what sort of therapy they're involved with. But some of our interventions, especially with the very young children, are very much about play and encouraging parents to play with their children. We use play a lot as a way of eliciting communication and social involvement with the child. And we'll also help parents to use meal times and other kinds of chores during the day to encourage their child to communicate. Okay. So Tanya informs me this is more about family therapy. Is that correct?
Yes.
So I think at different centers you're going to find all kinds of different interventions. Right now, most of our interventions are really focused on helping the child with those symptoms, so really focused on eliciting more communication and more social interaction. And we usually do refer parents onto support groups where parents and families are supporting each other. If that makes sense.
Thank you.
Thank you.
Спасибо за доклад, очень интересно и очень много нового и полезного. Вопросы, скажите, методы, вы там чуть-чуть коснулись, исследования, диагностика родительских состояний, стрессов, депрессий. Перечислите, пожалуйста, какие вы используете. Это один вопрос. Следующий, вы говорили о том, что очередь в центр, то есть родители ожидают. Какова она на сегодняшний день? Пока. Все, спасибо.
Okay. To answer your first question, one of the most common ways to measure parent stress is through the Parenting Stress Index, which is a form that parents fill out that talks about stress specifically associated with parenting. And then some studies have looked instead at rates of depression or anxiety in parents. And that's often just by the parent self-report.
опросники, да? А можно назвать опросники? Ну, вот, я, например, знаю там шкала Бека, шкала Шихана. Какие используете вы?
So the one study we have now that's looking at this uses the parenting stress index. And that's actually the only measure that we're currently using. To answer your other question about our wait, right now, from the time that parents first call our center with concerns to the time that we're able to diagnose them is about 9 months. And that's just because we have so many people calling, and we're testing every single day, but that's as quickly as we can get to them. And I think people at other centers have comparable waits for the diagnosis.
Спасибо, понятно. И огромное спасибо за идею привлечения студентов для консультации, ответа на вопросов, наиболее, может быть, часто задаваемых родителями. Спасибо.
Yeah, using students is one of the ways we're trying to do this in a cost-effective way.
Спасибо большое за доклад. У меня такой вопрос. А как много вы уделяете отреагированию гнева как стадии переживания горя? То есть вы как бы между строк это читается, что родители разочарованы, родители смущаются, как бы стыдятся своего ребенка, да, это про их чувство стыда, про их чувство гнева. Как много вы этому уделяете времени в работе с гневом родителей, с их горем, и гнев как обязательная стадия проживания горя для смирения в итоге? Спасибо.
Very good question. So this comes up for me a lot. When I give a diagnosis, sometimes parents are very angry, or it seems as if they're very angry with me. And so it's just important as a professional working for this parents for me to know that that is part of the grief reaction, that they're not really angry with me, or if they are, it's okay. So I usually... Okay, thank you. So I usually stay very focused on the child. So whether the parent is feeling angry or not, I focus the feedback when I'm telling the parents about the diagnosis, I focus on what's going on with the child and what we can do to help. And if parents are having some difficulties in coping with that, I refer them to individual therapy so they have a place where they can deal with and build some coping strategies for dealing with this tough news that they've gotten. And I really, really emphasize with the parents that in no way is their child's diagnosis their fault, and really focus on what we can do to help and trying to move them forward.
Здравствуйте. Кристин, скажите, пожалуйста, существуют ли печатные издания периодические для родителей особых детей? Если да, ну, в вашей стране, если да, назовите их, пожалуйста. Я имею в виду те, которые не специализированы для специалистов, а направлены на родительскую аудиторию с целью психологической и информационной поддержки. Спасибо.
I think there are probably several. One that's common in my area is called Kids Enabled, and it is a magazine geared towards parents, and it has articles and lots of resources for parents. I don't know if if other people know of that magazine, or there's probably other publications in different regions in the U.S. But the magazine in Atlanta is Kids Enabled. And Autism Speaks also has really nice forums for parents to talk about these things on their website.
Кристин, меня зовут Анастасия Рязанова. У меня вопрос такой, я психолог. Вот является ли семейный терапевт и индивидуальный терапевт для родителей частью вашей команды? Но дело в том, что есть разные мнения среди людей, которые работают именно с родителями. Да? Вот некоторые считают, и в разных командах это по-разному существует, что семейная помощь для семьи, да, должна быть оказана на другой территории другими специалистами, чем те, кто работают с детьми, потому что родители могут испытывать смущение, рассказывая о каких-то своих внутренних семейных процессах, думая, что это может повлиять на то, как устроено занятие с родителями. Да, вот мы, например, делаем все вместе на одной территории, ну, в частности, потому что в Москве есть большие трудности вообще с психотерапевтической помощью, родители пока еще не очень свободно обращаются за этой помощью, да, то есть, есть особая там культурная ситуация. Вот мои коллеги из Европы, там, в частности, у которых я училась, считают, что это должно быть вообще разделено для того, чтобы была эта privacy, да, личное пространство родителей. Что вы думаете по этому вопросу?
Another great question. So the main way that we're able to provide services to parents at this point is through our case management team. And so it's not really therapy per se, but it's somebody who's helping them do very direct problem solving towards accessing services. We're not able to do individual work with parents at my center because we're part of a children's hospital. And so within the children's hospital, our patients all need to be under 21. I don't think it's necessarily a bad thing for there to be therapy available to parents in the same building. But we sort of see parents' therapy as something parents are doing to take care of themselves. And we feel like it's important for parents to take care of themselves to help their child, but it's not sort of directly related. So most of our interventions are very directly related and targeted on the child's symptoms.
То есть у вас скорее такое психообразование для родителей, а там терапевтическая деятельность, у вас есть контакты со специалистами из других учреждений. Правильно я понимаю?
Exactly.
Да. Спасибо. Thank you very much.
Спасибо.
Добрый день, Кристина, и все участники форума. Также я вас приветствую. Меня зовут Иван. Кристина, мы являемся все детьми Творца, детьми Бога. И хотел бы вас спросить, практикуется ли в вашем центре при работе с родителями такое действие, как общение с Творцом и помощь Его? И если это практикуется, то желаете ли вы это нам здесь?
We don't have any sort of religion as part of our programming. And we see families who have a variety of different religions and different backgrounds. I think it's important if a family is religious, we encourage them to seek out their religious community and to seek support from that community. But nothing that we say to parents is explicitly religious at all.
Спасибо.
Здравствуйте. Меня зовут Ирина, я мама ребенка-аутиста. У меня практический вопрос. Вы говорили о том, что вы помогаете семьям приучить ребенка сидеть за столом, питание, сон. Вот что для этого используется? Медикаменты или поведенческие какие-то стратегии, или и то, и другое вместе?
So our feeding program, for some kids, it's a really intensive program where they come to our center every day and spend several hours with some behavioral therapists who it's not through medication, it's through behavioral techniques. So they might start off by getting children to eat just a tiny, tiny spoonful of a food they won't normally eat. And once they're able to eat that tiny bit, they'll get some sort of reinforcer or reward. And over time, they gradually sort of shape the behavior to where the child is able to eat a variety of food at the table, but it's all through behavioral techniques.
И еще добавок к этому вопросу. Семья тоже вся приходит и присутствует, вот когда ребенка приучают все вместе сидеть?
Yes, the family is very involved with that. The therapists teach the family the kinds of techniques they're using so that they can take those home and use the same sort of behavioral support to help the children get through meal times.
Thank you.
Mhm.
Поясните, пожалуйста, кейс-менеджер, нет, сейчас скажу, управление случаем, наверное, это кейс-менеджер. Вот как это организовано? Что значит управление случаем? Так было переведено? Да. Как у вас это организовано?
Case management is something that's new for us right now also, so it is not super organized. We're just starting a program. Right now we have a director of case management, we have 2 full-time case managers at our center, and about 4 students. But the goal is that from the moment that parents call our center, they will be assigned to a case manager, and that case manager will help walk them through the entire process. So help them with scheduling their first evaluation, help them with scheduling follow-up appointments, and follow them over time. The problem that we run into is it's very expensive and it's hard to find ways to pay for this kind of program. So we don't have the staff right now for every single family to have a case manager following them through the whole process, because we see 5,000 kids a year. So we're also in the process of seeking out donations from families to try to build this program. Everyone okay?
Кристин, добрый день. Меня зовут Мария. У меня вопрос относительно участия родителей. Так как вы несколько раз сказали такую фразу, что вы в первую очередь занимаетесь детьми.
I'm sorry, my interpretation stopped. There it is.
Так как вы в первую очередь занимаетесь детьми, меня интересует, насколько вовлеченность родителей обязательная часть условия коррекции ребенка. То есть если родитель участвует, да, вот вы говорили, игровые сеансы, например, да, присутствие на диагностических каких-то моментах. Есть ли у вас опыт, когда родители отказываются принимать участие, просто приводят вам ребенка в центр? Или это постоянно родитель включен в процесс коррекции? Как вы поступаете?
So we like for parents to be very involved. Our thinking is that we only have that child for a short amount of time each day or each week, but the parents are with that child all the time. So what we really want to do is whatever it is we're doing with the child, we want to teach the parents to do those same things so that they're able to engage in those kinds of activities at home, so the child gets much more benefit of the intervention. Every now and then we have a parent who thinks they're just going to drop the child off at the center, but we let them know right up front that they're going to be a very important part of the process. They're an important part of our team.
Какими методами вы добиваетесь их включенности? Это постоянное консультирование, пролонгированное, или есть что-то еще? Вы подписываете договор, например.
Often they are present during the different therapies the kids are going through. They absolutely sign a bunch of consents when we first get started. So sometimes it's just by observing what the therapists do, and then the therapist will do kind of a follow-up meeting with the parents to talk about what their homework is or what kind of things they can be working on at home that day.
Да, все, спасибо.
Спасибо.
Здравствуйте, я мама аутичного мальчика-подростка. У меня такой вопрос. Скажите, пожалуйста, вот какой у вас подход в стране к семьям, которые хотят завести второго, там, третьего ребенка? То есть вы автоматически как-то вот наблюдаете второго ребенка, он находится под угрозой, вы как-то вот намекаете родителям, подводите, или сами родители выявляют желание? Как вот с этим у вас? Потому что у нас обычно в стране сами родители больше как-то вот желание подстраховаться, проверить. Вот такое вот. А как у вас?
I think there's probably a lot of variability in how it happens in the U.S. There's no sort of formal national way of identifying or helping these second children. At our center, we have a research study that we're doing right now where we enroll families who are having a second child when their first child had autism. There's studies show that younger siblings of a child with autism have about a 20% chance of developing autism themselves. So for us, this is a really helpful group of kids to follow because we want to be able to help them as soon as possible if they do develop autism. It's also a great source of data for lots of our studies. If we're wanting to learn more about autism, this is a good sample for us. But outside of this one study that we have, there isn't a formal mechanism for necessarily catching these kids.
То есть получается, что родители должны сами как-то, если нет желания родителей, он этого не видит и не замечает, как у вас? То есть вы подводите родителя, ну, как-то вот тактично к этому вопросу, намекаете на это, чтобы родитель начал больше обращать внимание на ребенка? Получается так или как? Потому что у нас немножко по-другому все.
Yes, so in the United States...
Или может быть, извините, или может быть вы просто какие-то тесты даете изначально, просто как страховка такая, и уже у родителя на руках есть какая-то информация, скажем так.
So even in the United States, parents often have to really advocate for their children and often navigate these systems somewhat on their own. This is something that we're really trying to improve, to help empowering parents and communities and educating people about this. The test that we would do for those younger siblings, often we can't do until they're about 18 months old. So there's still a waiting period before we were able to bring those younger siblings in to give that firm diagnosis or to decide that they don't have a diagnosis. But when we can, when those parents are asking us, we do encourage them to really keep a close eye on development and to call us if they have any kinds of concerns about the younger sibling.
Спасибо.
Все, ваш вопрос будет последним. Извините, ради бога, просто время ограничено уже.
Здравствуйте, меня зовут Надежда. Вопрос вот такой. Вы сказали, что от момента прихода семьи в центр до постановки диагноза проходит 9 месяцев. Да? Вот почему именно 9 месяцев? Да? То есть чем вот обусловлено это время? И что вообще вот происходит в эти 9 месяцев? Что делаете?
That's a great question. The parents often ask that same question. We're completely booked. We have appointments scheduled with other diagnostic evaluations every single day up through the next 9 months. So my schedule is actually full right now up until May, every single day of the week with evaluations. And my first opening is in May, and so parents are just having to wait for our next open appointment. It's really hard, and we're looking for ways to make that wait a lot shorter.
А что вот делается в эти 9 месяцев, когда ребенок попадает к вам в центр? Вот до момента постановки диагноза. Вот вопрос в том, да, почему именно 9 месяцев от момента прихода до постановки диагноза? И как ведется работа с семьей в эти 9 месяцев, чтобы правильно поставить диагноз? А вопрос, что делается с ребенком, когда он обращается в центр для правильной постановки диагноза? То есть как долго это происходит?
Okay, so what we try to do is when they call, we encourage parents to go ahead and contact other places where they might be able to get services. So we encourage them to try to start speech therapy, to get involved in their school, if there's a special needs preschool program, to get involved in occupational therapy, because sometimes they're able to start some of these services before they see us for a diagnosis. And we're seeing them for that diagnostic appointment, the first availability that we have.
А вот когда...
Извините, пожалуйста, это был последний вопрос. Извините.
Спасибо.
Его можно будет задать во время свободного общения, но сейчас мы должны поблагодарить докладчика. Кристина, огромное спасибо.
Спасибо.